Hello again, everyone. My name is Marty Guthmiller, CEO at Orange City Area Health System, bringing you a special community briefing today. On Monday, I did indicate that we were going to be doing these briefings weekly, unless there was some information or an update that we wanted to provide. I am also living proof that the virus there's other viruses besides the coronavirus out there, COVID-19. But I have it. And I think the key word is living proof. And so I'm still battling the cold, but doing okay. So getting into the special briefing today, I wanted to give you an update on where we stand with the vaccine and with, more importantly, vaccinations, actually getting it to people. Today there will be a press release, a joint message from community health partners, all four hospitals and health systems in Sioux County and Promise Community Health Center as well, just giving an update and talking about what's currently going on. All of us in Sioux County are continuing to vaccinate folks according to the phase 1A priority that has been given to us by the state. And that is largely frontline healthcare workers, but also includes long-term care residents. What we want you to know, and you can refer to the copy of the joint statement on our Facebook page, but that as vaccines become available, and probably more importantly, when they become available by the thousands, there are going to be joint efforts, and we'll be communicating all along the way within the county relative to where the needs are, where the supplies are, that kind of thing. And again, those partners are community health partners, the four health systems in Haywarden, Rock Valley, Orange City, and Sioux Center, and Promise Community Health Center as well. One of the things to keep in mind is that the quantity of these vaccines are determined at the county level. They're not determined at the health system or local level. They're determined at the county level. We are notified weekly of what our allocation is expected to be about a week in advance. So for next week, as an example, Sioux County is expected to receive 100 doses. Orange City is expected to receive about 30 of that 100. And so we're talking about tens and maybe even 100, if not thousands. And that's very frustrating for us because we need to be talking about thousands. And we certainly have the capabilities to get that to the patients, get that to all of you, but we can't do that if we don't have the vaccine. And so the main message right now is that we are all talking in the county as a healthcare community. We are working together, and supplies are very limited at this time. The next phase of the allocation is to be going to what the state calls 1B. They're actually working right now to finalize what 1B includes, but it is a bunch of people. And again, it's going to be very difficult to equitably vaccinate the 1B folks when you're only getting 100 doses a week. We have thousands of people that will be likely in the 1B category. And so when we begin to receive those kinds of quantities, we can begin to organize and implement very efficiently the vaccination of those folks. And we've already talked about ways to do that. We have some experience in doing that in terms of the COVID testing that we've been doing. And we can literally do hundreds of people in a day if we have the supply for that. And so that information is coming as it becomes available to us, but we wanted to let you know that. And I'll give you just an update locally here as well in a second, but until that vaccine becomes available, again, the joint message will encourage everybody to continue to be vigilant, as we've talked about all along. Continue to wear a face mask, Continue to practice your social distancing, continue to do your hand washing and proper hygiene, and of course to stay home if you're sick. So continue to do all those things that we've all been way too accustomed to over the last several months. Now, a little bit of an update in terms of what's going on here. Good news, Tuesday, January 5, we vaccinated 81 of the 83 residents at Prairie Ridge. We had 2 residents that did not request the vaccine or turned it down. And so 100% of the nursing home residents that wanted the vaccine received the vaccine on Tuesday, and that was through the Walgreens and Pfizer model. The same is true with assisted living folks. 100% of those folks who wanted it received it on Tuesday. In addition to the Prairie Ridge residents and Landsman Ridge assisted living residents, all the senior staff at both of those facilities was eligible through the Walgreens program and did receive it through the Walgreens program on Tuesday. The second dose will be followed up with on January 26th. On January 26th, any remaining folks who did not get the first dose the first time will be given the opportunity on January 26th with a follow-up to that on February 16th. So very good news on the senior front, and we wanted to share that. That is outside of the allocation that we're talking about through the state, the 1A, 1B, 1C kinds of things. And so that is good news. We're very happy about that and wanted you to know that. In terms of the allocation of dosages here, Orange City area health system is in the range of 400 or so doses. We have administered approximately after today, we'll have administered approximately 80% of that. And we do expect the remaining doses, the remaining 20% to be gone probably by the first part of next week, either Tuesday or Wednesday. 100% of the frontline staff who have wanted the vaccine have received the vaccine. We do have some staff who refuse the vaccine because of the fact that they've had COVID fairly recently, know they have the immunities and are saving it for someone else, knowing that they can get their vaccine down the line a little bit, and that's fine. But I think it's important for you to know that 100% of everybody here that's asked for it and or wanted it has received it. We are also in the 1A category or 1A phase implementation of folks outside of the health system. So by those folks, we mean dentists, chiropractors, pharmacists, funeral home workers, workers at the Pioneer Home, as an example, in Orange City case. Those kinds of folks are eligible and are in the process of being contacted, and in many cases have already received the vaccine. And so those folks are being vaccinated in our community as part of the 1A community as well. So again, we do expect our allocation as currently expected to be gone by Tuesday or Wednesday that week of next week. And in some respects, that's a good thing because that tells the state that we implemented everything that you gave us, so give us more. If we don't vaccinate and use those supplies, the state has a tendency to look at it and say, well, okay, then you don't need more, apparently, if you can't get rid of what you have. And so it's important that we go through that vaccine as soon as we can for a number of reasons. The most important reason is to build up that herd immunity. But the other reason is to get resupplied again. And so until such time where we're in the thousands of quantities, you probably aren't going to see any kind of broad-based mass vaccination schedule out there announced, but know that we are prepared to do that, and we'll certainly implement that as soon as we have those supplies. So just wanted to give you an idea. The 1B, some of you might be thinking, when do we go to 1B? That's a great question. Best guess at this point is at least a couple weeks. And so we want to continue. Again, that's going to probably be on the supply end. It depends when we get it, when the state has those quantities, when they actually release us to do the next tier of people. That's it for today. Hopefully this helped. Hopefully it creates a little bit less confusion out there. We will continue to get this vaccine to you as soon as we can. It's in all of our best interest to do that. We do not want to sit on any quantity here any longer than we have to, but it is a high priority of us to be very equitable in how we administer this vaccine, and again, keeping in mind compliance with the state guidelines, but also keeping in compliance with what we know to be the highest risk population as well. And so again, thank you for joining us. Hopefully this is helpful, and we'll see you next week on the more routine version of our community briefings. Okay, again, that's it for today. Thank you.